Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video in response to a question that someone had posted on one of my other videos. They were asking, what type of magnesium do I like to use the best when people are dealing with constipation? And I'm trying to remember now, I can't remember if it was within the context of constipation associated with SIBO, which is small intestine bacterial overgrowth, or if it was just generally about constipation. I don't really remember, but the answer is the same either way. So, constipation's constipation in a sense. And in terms of the type of magnesium that I like to use, it really varies. And at the end of the day, of course, please consult with your healthcare provider to figure out the best type of magnesium for you. What I usually gravitate towards is using something called magnesium glycinate. That is the exact same thing as magnesium bisglycinate. It means the same thing. And I usually recommend magnesium glycinate because I find that we can get a truer sense of how much magnesium a person actually needs for their optimal bowel regularity. To my understanding, the research has not been done to elucidate exactly how different types of magnesium are absorbed and utilized in the body, but it seems that magnesium glycinate is better absorbed than other types of magnesium, like say magnesium citrate, or certainly better than magnesium oxide. And my understanding of it is that magnesium glycinate is at least purported to be preferentially taken up into muscle. And so my rationale as to why I seem to find better results with things like magnesium glycinate versus more common types of magnesium like citrate or oxide, I think is because the magnesium is actually getting taken up into muscle, including the smooth muscle in the bowel. And if that smooth muscle in the bowel is deficient in magnesium, then it's going to have more of a predisposition to going into spasm. It's not going to contract as easily and as readily as it would if the magnesium levels were on track. And so what I think is happening there is that the magnesium glycinate is not only helping to keep the bowels moving through more of a laxative type of effect, because the magnesium that's not absorbed draws water into the bowel and helps to by bringing more water into the bowel, it helps to flush the bowel out, so to speak, which is why taking too much magnesium can cause a loose stool or diarrhea if you really overdo it. But I think in addition to that, the magnesium glycinate might actually be helping to address the bowel function itself. And so I think it might be working in a couple of different ways. Again, unfortunately, to my understanding, there hasn't been comprehensive research looking at this, so it's kind of just my theory, or my working theory anyways. But what I can certainly say from clinical experience is that I've had patients who have been working with magnesium citrate, for example, and nothing against magnesium citrate. It's lovely, and some people do much better on citrate than they do on glycinate. But I have had a number of patients who have found that they're taking magnesium citrate, their bowels are moving better, but they're still not perfect, or they have a hard time finding that sweet spot between constipation and at least if they're constipated, so they take more magnesium, but then they get loose stool or diarrhea, and they can't find that happy medium. What I find is that in a number of cases over the years, probably a few dozen cases where I found that they're having trouble with, say, something like magnesium citrate, I put them on magnesium glycinate, and then they find, oh, that's working a lot better for me. I can find that sweet spot more easily, and so that's kind of why that's my magnesium of preference. On very rare occasion, I found that some patients have a sedating effect or they get a sedating effect from magnesium glycinate. Glycine, which is an amino acid, is to my understanding, the most potent inhibitory or calming neurotransmitter in the spinal cord, and it has an overall relaxing effect. And so some people seem to get a little too relaxed from the glycine that's in there, but that's very, very rare. I would say that I've only seen that in less than a handful of patients to date. So it generally well tolerated, seems to work quite well. Of course, talk to your personal health authority to figure out whether magnesium glycinate is something that you should work with, and figuring out the right dosing and all of that. But I hope that information is helpful. If anybody has any other questions about this topic or anything else, just let me know, and I'm happy to post videos in response to those questions.